News today. Okay, good afternoon, everybody. Thank you for joining us. Sorry to keep you for a few minutes. We have a lot of news today, a lot of changes. So bear with me as I go through a number of updates and important new announcements. As a reminder, we are now at a phase where I'll do these Monday, Wednesday, and Friday at 1 o'clock. So please tune in again on Monday of next week, Monday, Wednesday, and Friday of next week. There's going to be a number of different announcements as we start to think about phase 3, the summer, where we're going from here. So I would just encourage you all to continue to tune in. It's our time together as a state to come together and get the information that we need to deal with the ongoing coronavirus in Rhode Island. I want to begin today by recognizing the importance of today's celebration. I want to recognize that today is Juneteenth, excuse me. It is an important holiday, and it's a celebratory holiday. It's an important holiday. It's also, I would say, a time to reflect. Now more than ever, it's a time to reflect and to ask ourselves what we can do, each and every one of us, to end the scourge of racism and to bring about the promise of a more equal and equitable Rhode Island, to remind ourselves of our ugly history as a country as it relates to slavery, discrimination, and racism, and to commit ourselves to a brighter future where nobody is discriminated against on the basis of the color of their skin. So I'll be joining some Juneteenth celebrations later today, and I would urge all of Rhode Islanders to take some time today to celebrate or reflect in your own way. Okay, we'll begin today, as we always do, with the data. If you could please put that up on the screen. Today we have 68 new cases. So again, good news. We're holding steady at a low number. Hospitalizations trending down. Sadly, another 9 deaths. I cannot wait for the day that I can get up here and report no deaths. We aren't there yet. As I've said so many times, we are not out of the woods. The virus is here. It's here to stay until there's a vaccine. We have no reason to believe that it has abated. What we do know is that we've changed. And all the changes we've made have made a difference and have been literally and truly saving lives and keeping people out of the hospital. Having said that, every time I see the data, I'm reminded that many more people are getting sick, people are still in the hospital, people are still on ventilators, and sadly, we continue to lose lives to this virus every single day. So I would ask you to remember that, and I would ask you to stay safe and continue to follow the rules. We have been in phase 2 for a little more than 2 weeks, just over 2 weeks. So I would like to take some time today to start to preview what phase 3 will look like. I want to just say this. Phase 1 was very limited. In phase 2, which we've been doing for a couple of weeks now, we have reopened almost every part of our economy. Businesses, manufacturers, retail, hairdressers, barbers, gyms, church. You've seen a broad reopening. And the data still looks good. Phase 3 is going to be an even more significant reopening. Really, essentially everything will be reopened in some form or fashion. The only way that's going to work is if we work even harder, all of us, to follow the rules. And I'll tell you, personally, that's a hard message. It feels strange. On the one hand, the weather's getting better, the virus seems to have subsided, we have fewer cases, but yet we all have to follow the rules even more. And the reason is because we're all going to be getting out more, social gatherings are going to get bigger, and if we don't try even harder to wash our hands, stay home if we're sick, don't leave the house if you're sick, get tested if you feel unwell, stay 6 feet away, avoid big crowds, wear our masks. If we don't all do that even more, then when we reopen the economy, we are going to get into trouble. My approach this entire time has been not to be heavy-handed with enforcement. You know, we don't want mask shaming or fining people unnecessarily or heavy-handedness. And we're not going to take a heavy-handed approach. I mean, if we have enforcement and we're serious about it, we've ramped up our inspectors. We have a lot more inspectors, and we're going to continue for businesses, and we're going to continue to increase our inspection of businesses. But we're not out to, you know, slap you on the wrist. We're out to remind you to comply and to help you to comply. And if, however, you're flagrantly and continuously violating the rules, then we are going to fine you and in the worst case scenario, close you down until you comply. My point is this: I'm asking you to follow the rules because I want you to take pride in being a Rhode Islander and take pride in the Rhode Island response to COVID. You guys are awesome. Rhode Island is leading the nation in our cases declining, in our compliance with mask wearing, in our testing. So keep it going. Be proud to be a Rhode Islander. Keep it going. Don't follow the rules because you're afraid of getting into trouble. Follow the rules because it's the right thing to do and it keeps your neighbors and your family safe. Like, again, we wear our mask not for ourselves, for the person who we might make sick. So with all of that as a caveat, and I'm asking everyone to try a little harder and make smart choices to keep everyone safe, I'd like to ask you to please put up on the screen phase 3 guidance. So let's talk a minute about phase 3. In phase 3, indoor social gatherings should be no more than 50 to 75 people. Why the range? Low risk is 50. If you're willing to take a bit more risk, it's 75, and 75 is the limit. Outdoor social gatherings should be no more than 75 to 150. Same thing, low risk, 75. If you want to take higher risk is 150. 150 is the max. What's a social gathering? A social gathering is a party, a wedding, a networking event, quinceañera, a backyard barbecue, a graduation party. Here's how you think about it. It's a gathering of people, all of whom pretty much know each other and will be mingling. So it's not going to a restaurant where you go with a few people and don't know everyone else. It's a gathering of people, friends, family, who are all going to be mingling together. If you do that outdoors, we ask you maximum 150, indoors maximum 75, but we're telling you it's lower risk. The lower the number, the lower the risk. Now, you might be hearing in what I'm saying a different approach, and that's intentional. So I want to take a minute. In phase 2 and in phase 1, we gave very detailed, strict guidance, setting by setting, industry by industry. We thought that was appropriate. Phase 3, I want to take a different approach. We're going to trust you to do the right thing. Everybody in Rhode Island now understands the risks, understands how to reduce the risk, and should understand that it's in your best interest to follow the rules. Furthermore, it's the right thing to do as a Rhode Islander to protect your community. Also, we need to get out of, we could be living with coronavirus for a year or more. So slowly, I want to get out of the business of telling everyone exactly what to do, exactly how to do it, but rather to provide you with guidelines and leading from a place of trust and confidence that you're gonna live within those guidelines, follow the rules, and reduce the risk. On social gatherings, I do want to say this, because of course it's summer in Rhode Island. We get a lot of questions about weddings. Weddings are once in a lifetime event. They're also a big part of our economy. I was in the flower shop this morning. A woman said they've already lost 17 weddings, which is heartbreaking. Let me give you a flavor for what I hope phase 4 to look like, which we hope, knock on wood, no promises, but assuming everything looks good, we'll begin phase 4 in August. By phase 4, social gatherings, including weddings, we'll probably see limits of about 100 inside and 250 outside. So if you're planning a wedding in July, August, September, I hope that this gives you some guidance and you can do some advanced planning. Recognizing, of course, that if things change, if we see a spike, if there's some unforeseen increase in cases, then I'll have to adjust. Okay, I want to talk now about other places of interaction, not social gatherings. So all indoor settings that are currently operating at a square footage capacity, which is essentially retail stores. In phase 3, you can increase up to 1 person per 100 square feet, provided that you follow all the other rules that you're currently following. Mask wearing indoors, providing for 6 feet of distance, marking where people can stay in line so there's 6 feet of distance, providing hand sanitizer, etc. All indoor settings currently operating at a % capacity cap, for instance, restaurants, can increase up to 2/3 capacity in phase 3, 66%. So that's restaurants, places of worship, anything that's currently governed in phase 2 by capacity, % capacity, you can go up in phase 3 to 66% or 2/3. Again, as long as you continue to comply with everything else, hand washing, sanitization, temperature screening, mask wearing, 6 feet markers, people in line, no bunching up, please, no bunching up in line, no bunching up and congregating after mass, after a service, etc. Everything you now know, we now know, being in a crowd for any length of time is a bad place to be. Being next to people for more than 10 minutes is a bad place to be. So just be aware and follow the rules. In phase 3, pretty much all indoor venues that remain closed in phase 2 can reopen. So that would be like movie theaters, bowling alleys, arcades, museums, performance venues. We're going to allow these venues to reopen at up to 66% of capacity or 100 square feet per person, provided that everyone can maintain 6 feet of distance. It's always the same thing. Make sure you can have the 6 feet of distance. There are a handful of very large venues like theaters, auditoriums, think like the Dunk in downtown Providence, where these capacity restrictions could result in very, very large groups, like over 1,000 people. Fortunately, we're a small state and there's only literally a handful of these large indoor venues. So to that end, any large venue of assembly that wants to have more than 250 people in an indoor space, we're asking you to submit a specific individualized plan to Commerce and the Department of Health, and we'll go through and approve of your plan just to make sure that we think you have the proper precautions in place so you can do it safely. The documents that are on your screen now will be posted later today on reopeningri.com. Next week, Commerce will continue to update reopeningri.com with a little bit more information. But again, it's not going to be the extreme detail for phase 2 because we want to aim to a place of guidelines and let you figure out how to best live within those guidelines safely for phase 3. I want to take another second to briefly address outdoor settings. This being summer, hopefully we'll all spend time outside. Parks and outdoor theaters in particular. Here's the good news. We now know pretty definitively that increased airflow outside significantly decreases the likelihood of spreading the virus. And that means we know larger gatherings can happen outdoors safely if we maintain social distance. So to that end, in phase 3, as I said, there'll be no cap on the number of people who can be in an outdoor setting at one time. So that's good news. That's great news. But we still have to be careful. So we don't recommend going above 250 people. It's our job, led by Dr. Alexander Scott and her team, to tell you what we think is safe. That's why we're saying this is low risk, this is higher risk. So technically you can have go to an outdoor venue, fireworks or something with more than 250 people outside. But we don't think that's a good idea. We don't think that's safe. But we do know if you're outside, it's much safer than inside. What we're asking you is, if you're a municipality or some other big organization, and you are planning on an event outside of 250 people or more, please get in contact with us so that we can help you provide guidelines so we can keep people safe. So if it's an organized event, like a festival or 4th of July or something, and there's gonna be more than 250 people outdoors, we need you to be in touch with us. We wanna understand how you're gonna go about it, and we might require you to give us in writing a specific plan so we can have confidence that you're going to keep everybody safe. I also want to say we're here to help. We're not here to be heavy-handed with enforcement. We're here to help. We want everyone to be safe, and we want people to go back to work, and we want people to enjoy this summer. So call Commerce, 521-HELP, 521-HELP. Someone will answer the phone, and they'll listen to you. Call the Department of Health. Go on the Reopening RI website. Ask a question. Everything I just said will be online, but really we're asking you to work with us for the good of the community. And we're giving you guidelines that we believe will keep everybody safe, because the last thing we want is a surge. There are states seeing a surge. There are states right now that their hospitals are at capacity. Not Rhode Island. Let's never let it be Rhode Island. We can have a very fun summer and get more people back to work and do it safely if we just really try to follow the rules. And by the way, I will say it's a gorgeous weekend. I'm sure there'll be people going to Block Island. Please do the right thing on the ferry. Please, you got to be on the ferry for an hour. If you're sitting right next to the same person for an hour, please put your mask on. Go, have a good time in Block Island, but do the right thing. We don't want an outbreak on the island. We don't want an outbreak anywhere. Okay, a few more notes and then I want to move on to schools. As we've already announced, but it's important to remind you, summer camps in Rhode Island reopen Monday, the 29th. We've already released the guidance, and nothing I've said today changes that guidance. We already have approved plans for almost 9,000 spots for kids for summer camp. We just received a number of other plans. If you're a municipality or a municipal leader who hasn't sent us a plan yet, we'd ask you to think about doing it, and there's money available to help you. We want to be able to get as many kids in summer camp or recreational activity as possible, and that starts June 29th. Some more good news, we will also be updating childcare guidelines for phase 3 to increase the group size from stable groups of 10 to stable groups of 20. So phase 3, childcare, is going to go from stable groups of 10 to stable groups of 20. First of all, hats off to the child care providers. You're doing an unbelievably terrific job. We hear from parents every day. Thank you, thank you, thank you. We're also hearing from child care providers that they want to and need to be able to go up to 20. So phase 3, you go up to 20. Next week, I will be back to you with more information about youth sports guidance for phase 3 and adult sports guidance for phase 3. There will be some relaxation there. To be clear, that's just phase 3, which will be just the summer. I'm not yet ready to release guidance around, school sports when the fall comes. And then finally, the Department of Health is working individually with nursing homes and assisted living facilities on plans to allow visitation with limits in phase 3. So to those of you who've been hanging on for all these months without visiting a loved one in a nursing home, hope is on the way for phase 3, and we'll be providing that guidance next week. All right, I'm joined today by our Commissioner Infante Green. We have been working very hard around schools, and I'd like to take a couple of minutes to preview how we're thinking about school reopening. So let's begin with the goal. The goal is schools reopening in person, nearly every kid in school in person, August 31st. That's our vision, and we have a couple of months to get there. Since I made that announcement a week ago, I've heard a lot of excitement from parents and students who are more than ready to go back. So I want you to know we hear you and we're working hard to enable that. I've also heard a fair bit of anxiety from teachers and principals and superintendents whose jobs just got a lot harder because they're going to have to work all summer to figure out a way to deliver a high quality education safely and in accordance with public health guidance. And all I want to say to all of you is we're going to get there. I don't know exactly how as I stand here today, but we're going to figure it out because it's the right thing to do. And for the past 3 months, we've been flexible and innovative, and that's what we're going to do. And so later this afternoon, by the end of the day today, we're going to have our full school guidance for the cities and towns online at reopeningri.com. So reopening, if you are a superintendent or a mayor or principal, et cetera, by the end of the day today, online, reopeningri.com, we're going to have the guidelines for you so you can get to work and start to figure out what's best for your particular community in getting ready for school following these guidelines. Let me tell you what our principles are. First principle is health and safety first. We're never going to do anything that we think endangers the health, safety, and lives of our students, of our teachers, of our educators, of anyone in our school community. Secondly, we're going to be transparent. There's going to be a lot of changes. I can't stand here today and say this is exactly what's going to be required to deliver schools safely in 6-9 months from now. But I can promise you it'll be transparent. You'll know what's happening, you'll know why it's happening, and we'll have a dialogue. We're going to do our very best in a changing landscape to provide information in a transparent way. We're going to prioritize equity. Not every community has been equally affected by this terrible virus. Exeter looks different than Central Falls. Providence looks different than Smithfield and Burrillville. Areas within Providence look different. Neighborhoods in Providence, one place, look different than other places. So we're going to focus on equity to make sure everybody is equally safe and secure. We're going to listen constantly, and we are going to provide creative solutions. We're going to have to get very creative, and we're going to be decisive. We're going to make decisions, and if we have to change them, then we'll change them. We're going to make a decision, and then if we have to change, we'll change. This week, I had the opportunity to spend quite a bit of time on the phone with superintendents. It was very useful for me, very instructive. I'm going to do the same thing with teachers, same thing with principals, same thing with students, same thing with parents. And the team, the commissioner does obviously even more of this than I do. Listening, listening, listening. But we have to recognize it's going to be hard. It's going to be different. It's not going to be, we cannot just say this is the way it was. You know, like transportation, it's going to be hard. Transportation will be hard to figure out. We cannot just say double the number of yellow buses. What we have to say is, how do we reduce the demand for busing? How do we increase the supply for busing? And how do we do all this to make sure that it's safe and affordable? And that's going to require us to get pretty creative. So it's going to be hard, but I'm looking forward to the innovation and the creativity. It's also going to require our school districts to have contingency plans. So full in-person learning for nearly every kid is the goal. That is going to require elementary and middle school students to keep students in stable groups of 30 or fewer. So that means the same 30 kids should be interacting every day. And I would ask if you could please put on the screen the mock-up we have of an elementary and middle school. It's similar to what we're doing with summer camps. We don't expect these kids, they're children, we don't expect them, we cannot expect them to stay responsibly 6 feet apart at all times. We try, but it's not reasonable. So therefore, we have to keep them in a stable group of 30. And anytime more than one stable group is in the same place, so maybe like 2 groups of 30 in the same space, cafeteria, whatever, the 2 groups have to be 14 feet away from one another. For high schools, we're recommending that students stay in stable groups whenever possible, but we recognize that that's going to be harder given the way that classes work. Please put up the mock-up for the high school classroom. So the good news is high school students, a little bit older, hopefully we can count on them to keep social distancing a little better. And so in high schools, students and teachers will either need to keep 6 feet of distance or wear their cloth face mask whenever they cannot maintain stable groups. Now, this is the plan, that's plan A. But if we start to see concerning trends, an outbreak, a spike during flu season, then we'll need to scale back and we'll need to move to option B, which is partial in-person learning. And we're going to have to ask school districts to provide this contingency backup plan so they can move quickly to partial in-person learning. For elementary and middle school, this will look similar to the full in-person learning. For high schools, we'll have to scale back. There'll be a lot more detail online today, but I just want to give everyone a flavor, parents in particular who might be wondering. If it gets even worse, we need a plan C. We'll need to restrict in-person learning even more. Then we'll transition to very limited in-person learning with the focus on prioritizing our youngest kids, our differently abled kids, and our multilingual learners to be in person. Because our experience showed that there are certain groups of young people, certain groups of students flourished with distance learning. That needs to be said. There are many students, particularly high schoolers, who did very well and actually even better with the flexibility of distance learning. But the smaller kids, as I said, multi-language learners and those with differing abilities, we're going to do everything we possibly can to always keep them in person. Obviously, in that plan C, there'll be group sizes will have to go down and more stringent guidelines. One of the unique challenges with schools, of course, is that they have so many different settings and type of interactions. It's very difficult. And so in addition to the setting and situation-specific guidance, there are going to be many other just practical and common sense measures that we are going to suggest to schools. And to this point, I want to very publicly thank Commissioner Infante Green and her Deputy Commissioner Anna Riley and their team at RIDE. They've been really burning the midnight oil to try to get this right. They're going to be a helping hand to you on the ground in your districts. You have to take the lead. You have to operationalize this, but we want to help you and make sure you get it right for your community. And as always, thank you to the team at RIDO. Much of what I've said, pretty much everything what I've said, will be online today by the end of the day at reopeningri.com. I will say this, we learned so much in distance learning, and we're not going to throw that out the window. As I said before, we are committed to making sure every child has 180 days of school, even if they're sick. And kids are not going to be able to allow to go to school anymore with the sniffles and a 99-degree fever. They're going to stay at home and do distance learning. Snow days, stay at home and do distance learning. A mini outbreak at a school or an outbreak at a school is not shutting down the whole state. That school does distance learning. We know how to do it. We know it can work. And so we're going to have contingency plans. So next year, children have a full, complete, robust learning experience in schools. We are asking our districts to submit their reopening plans for each of these three scenarios, Plan A, Plan B, and Plan C, to the Department of Education by July 17th. So today we give you the guidance, we work together, and July 17th, we need to see your plans, A, B, and C, along with budgets to explain how you're going to creatively fund these plans. And of course, earlier this week or last week, I announced an additional $50 million to help cities and towns meet these needs. All right, that was a mouthful. I'll simply say I'm excited to work on it, and we're going to have to be flexible and nimble and patient and calm and know that some way we're going to figure out a way to get through it. And as I said before, this isn't the new normal. This isn't the new normal. This is a better, more resilient Rhode Island and a better, more resilient school system. I want to take a second to talk directly to the students out there. You have really sparkled throughout this. I mean, you have risen to the challenge at every step, and it's been tough, not seeing your friends, no after school activities, not seeing your teachers, ending school without being able to say goodbye to your friends and teachers. It's pretty tough. I wish it had been different, and I know some of you are really struggling. We're going to continue to help you. I'm looking at ways to increase funds for mental health so we can help you meet your mental health needs to get through what you're going through. But I would say, I hope you're as proud of yourselves as we are of you. We never had to go through anything like this when we were growing up. And it's pretty incredible what you've done. And next year is going to be better than this past year. And we've learned from you about how to make it even better. And here's one example of why every Rhode Islander should be proud of our school kids. So don't take my word for it. This is one fact which is stunning and fabulous, which should give every adult in Rhode Island hope and confidence in our future, because these are the kids we have in Rhode Island. 3 days ago, I announced that we were going to have a SAIL initiative. Our SAIL initiative is summer coursework. We said to the young people, go online, go to the RIDE website, and sign up for free online coursework this summer. I announced that on Monday. By today, before this press conference, the briefing I just got, more than 2,000 students have already signed up for classes, and the numbers keep going up. That's incredible. You just finished a tough school year. It's summer, and thousands of you have taken the initiative to go online and sign up for online classes for the summer. I want you to know we're continuing to add We're going to try to keep up with you, and we've heard some of your requests for different kinds of classes, more interesting classes, makeup classes to help you with some of the material that was hard. Keep checking the RIDE website for the SAIL summer coursework platform, because we're going to continue to add options to the menu. For those of you who've signed up, way to go, have fun. Those of you who haven't, take a minute, go on the website and sign up. Okay, last announcement for today. This is an important announcement, and I know I've taken up a lot of your time already, but bear with me for this one. So as I've said many times, COVID's been tough on everyone. And if you're out there and you're saying, why is this so tough for me? Why am I so down? Why is this so hard? I have news for you. We're all saying the same thing. We're all in this boat together. But for some people, it's been devastating. The people for whom it's been devastating are people who are already struggling. People who are living paycheck to paycheck, people who are couch surfing because they had no stable housing, undocumented immigrants who are living in the shadows and working in often jobs that are working full time, but they're in poverty. Kids who are struggling. It's been really tough on them. So every time we meet as a team, we ask ourselves, how do we help the most vulnerable to get through this? Anyway, one of the groups who has been hardest hit is our immigrant population in Rhode Island, and particularly the undocumented immigrants in Rhode Island. And it isn't right. These are folks who, for all practical purposes, are Rhode Islanders. They live in our communities. They work in our hospitals, nursing homes, and grocery stores. They send their kids to Rhode Island schools, and they are suffering and, frankly, not eligible for the federal benefits that other people are eligible for. So as I come up here and talk about certain benefits and stimulus funds, the group of undocumented immigrants in Rhode Island haven't been able to receive any of them. But these are the people who, many have had to work the entire time through this crisis, often working in healthcare on the front lines, often working full time and not making ends meet, and having to deal with COVID. So we decided that's not right. That is not right. Not in Rhode Island. We're a state of community and caring, and where neighbors look out for neighbors. So we're going to do something about it. And today I'm excited to announce the launch of the We Are One Rhode Island Fund. It's a fund that's going to provide direct cash assistance to Rhode Islanders who are unable to benefit from most public programs due to their immigration status. These folks deserve our support, and I know I'm going to work my tail off to raise money philanthropically in this fund, and I would ask you to do the same thing. We have a goal to raise $3 million. This money is going to be used to provide thousands of families in need with $400 debit cards. And I am calling on all Rhode Islanders with means, if you are in a position to help, if you're one of the lucky ones who's gone through COVID with your job intact, I'm asking you to help us out. And we're making it easy for you to give. We've partnered with Dorcas International and Good World, two well-known, well-established nonprofits in the community. You can text We Are One, capital W, E, R, and the number 1, We Are One, to 27126. 27126 to donate. Do it right now. If you're listening to me, you have a little money in your pocket, please do it right now. Dorcas will be facilitating this program and working with community partners to ensure the assistance gets into the hands of families that need it most. The Rhode Island Foundation has also established a fund for larger donors, and thank you, Rhode Island Foundation. I think I've called them a dozen times through this crisis, and they've said yes every time. Thank you, thank you, thank you. More information is available at the Rhode Island Foundation website. So those are for companies, foundations, maybe families who are in a position to give a lot more. I want to be clear, a donation of any size helps. If you can give $10, give $10. If you can give 100,000, give 100,000. If you're a company or very wealthy, you want to give $500,000, send us the money. These people need it. They're going to use it on food to feed their children, on gas to put in their car. We've seen, like in other places like Los Angeles that have done a similar thing, the money goes to the most basic necessities. And these are people who are in our community working and ineligible for any federal aid. So I would just say, we're going to get to that 3 million. I hope we break through that goal. Again, I'd ask you to come together as Rhode Islanders. If we're in this together, we're going to rise together. We're going to continue to take care of one another. I want to thank Mayors Elorza, Diosa, and Grebian. They have been great partners in this, and their communities have struggled disproportionately. We're doing this in a broad partnership with local community organizations, Dorcas International, Progreso Latino. Thank you both for stepping up. I also want to thank Accelerator for America. It's a national program. They've agreed to donate to this, the Rhode Island Foundation, and the United Way. Because of those partners and some work that we've done, I'm launching the fund today with $600,000 already committed. It's a good start. And just like we're going to crush COVID-RI, we're going to crush the $3 million goal, and we're all going to do it together. So let's get it done. Text "We Are One" to 27126 and donate. Okay, I know that was long. I apologize. It was a lot of news. I'm going to turn it over to the commissioner and then to Dr. Alexander Scott, and then we'll come back for questions.
Thank you, Governor Raimondo, for your leadership around COVID, but also in many other areas. As you heard, the governor opened up with Juneteenth. If you don't know what Juneteenth is, which I'm sure you do, but if you don't, it's a good exercise to do with your kids today. Nice research. It's a very important day in American history, and we need to honor it, and we need to get more information around it if you don't know. And that begs us to do a better job with our history curriculum, and we will be looking at that. So I'm very excited about that. The other piece that I want to mention is I was asked the last time why I speak Spanish. I speak Spanish during this forum because I can, and because I'm bilingual. And when you're bilingual, you think in both languages. And my goal as a constant educator is thinking about how we get all kids in Rhode Island to speak both languages. So those of you that don't speak Spanish during this session, maybe you'll catch a few words. It's also a good experience for us all. So I'm excited to announce that. But as we think about reopening schools, one of the things that are most important that the governor said is the ability to be flexible. We don't know what it's going to look like August 31st, but we need to have plans for whatever it looks like. So that's why we're going to have these 3 plans in motion, so no matter what comes our way, we're able to be prepared. So that's what is important about what we're releasing today, is the guardrails and the guidelines of that work. We want to thank the Rhode Island Department of Health, because we have been working together very, very, very closely. And we are one at this point in terms of how schools open. Important for you to know about the guidance that will be released today is that it's a comprehensive roadmap for planning for these scenarios. It contains detailed sections on class and group size limits, and I'll talk a little bit more about that, classroom layouts, cleaning protocols, face coverings, screening students and staff, school schedules, visitors, busing and transportation, activities like recess and field trips, supporting vulnerable groups, and responding to staff or students who are sick. What we do know is that we're going to have a hybrid model, no matter what. As you've heard the governor, if your child has the sniffles, is not feeling well, they will continue to receive instruction virtually. And we're working regionally to make a lot of this happen, which is important to note. So the LEAs are required to submit a plan that covers each of the 3 specific scenarios. Limited in person, which we've broken that down to 15 students, partial in-person, which with the limit of 30 students within the class, and full in-person. We have put a strong emphasis on equity, as you heard the governor, making sure that most our educationally vulnerable learners are a priority in all our planning efforts. Quería traducirle, darle la información en español. Nosotros estamos muy agradecidos del liderazgo de la gobernadora de trabajar con el Departamento de Salud para poder traerle un plan a los distritos. Van a tener 3 planes que van a tener que crear. Por si estamos parcialmente, estamos nosotros limitados en el número de alumnos y si estamos todo ya completamente en la escuela. Entonces los directores, los superintendentes, la comunidad tienen que planificar para todos los casos que ocurran. Y antes de empezar, le expliqué a todo el mundo que yo hablo en español porque yo puedo y tengo mucho orgullo de la habilidad de ser bilingüe. Y por lo tanto, es importante que nosotros hagamos eso una prioridad de también el trabajo del Estado. So the guidance, which I want to emphasize, are guardrails, right? Because the plans will look different in different places. The plans are very specific so that the district's leaders have a very clear guide that they can follow as they develop their plans. For example, transportation section outlines exactly what it should look like, the different options that exist, how we offload or unload kids onto the bus, the distancing that needs to happen, where kids will actually sit, whether they have assigned seats. There's tons of scenarios. Cleaning. You may think that it's okay, we're going to clean, but in between, what happens in high school? We have to clean desks. We have to clean everything that we touch. So there's a whole different protocol, and that time has to be put in place so to allow for that to happen. Because you heard the governor, it is the most important for us to return to school safely, right? So all these protocols have to be in place. In each section, the guidelines outlines policies required to safely open and recommendation for implementation. So the districts are required to submit the plans by July 17th. The RIDE team will be giving feedback and guidance on an ongoing basis until July 28th. The part that's really important is that we have made a concerted effort to have RIDE be an agency that supports the districts. We have a compliance hat, but with that being said, what we're doing is that we are going to continue our point of contact. We did that when we went through distance learning, which was very successful, to help the districts. The districts are not going to do this on their own. We are working regionally, we're working individually. We've already met with the superintendents individually so that we can have information. We are partners in this work. And to parents and community leaders, give the superintendents your support because this is hard. We've never done this before. And we're doing it together. So I think that it's really important for us as we move forward to know that all these supports will be in place. We also want to make sure that everybody knows that these plans will be public on the website July 31st. The governor talked about transparency. We want everyone to know. With that being said, part of the plan is how the schools are going to educate parents, teachers, educators, families about what the new protocols are and how to stay safe. So that is part of something that they have to build in. So you may be asking, well, there's a lot of examples, you read the plans, but your district will make sure that you have that information. One other important note, private schools are required to complete the school opening plans aligned to this guidance and to post it on our website by July 31st. They will not be required to submit it to RIDE, but they should have it to produce upon the request of RIDO. If there's a positive case or an outbreak, I want to conclude by saying that our guidance is always based on the most up-to-date health recommendations. We are working hand in hand with the Department of Health, and these things may change as time goes on. So I really want you to be prepared for us being flexible. But what we're doing here is amazing because we were able to shift and make plans in a week. We have a couple of months to get this done, to get this as close to right as possible. So I want to thank you all. I want to thank the kids. You guys have been amazing. The governor mentioned the summer program. That was created from your feedback. That's extremely important. And parents, your kids will get college credit. So if you haven't signed on, make sure you do. So we're here to be partners and we will keep you informed as we go on. Nosotros aquí estamos para ser sus compañeros, para asegurarse que los distritos tengan el apoyo. Nosotros vamos a tener personas de nuestro equipo que va a apoyar a los superintendentes, asegurarse que los planes estén accesibles para que todo el mundo lo vea en el internet, pero también que se preparen para darle información a ustedes. Parte del plan es eso, que tengan información todo el tiempo. Y los alumnos, quería darles las gracias porque los planes que se hicieron para este verano fue basado en la información que ustedes nos dieron para poder crear esos programas. Y padres, si ustedes no saben, muchos de los cursos que van a estar, que son accesibles ya, se le va a dar crédito de la universidad. Por lo tanto, por favor, aprovechen la oportunidad y estamos aquí para apoyarlo y siempre trabajar en conjunto. Muchas gracias.
Good afternoon. Thank you for continuing to be with us. We have so many important updates today. I'm just going to give a few brief ones to move us forward so that we can talk through the data. I also want to echo the governor's and the commissioner's sentiments in acknowledging Juneteenth, which is the day we recognize the ending of slavery in the United States. It is a truly important day for people throughout Rhode Island and throughout the country of every race and ethnicity. So I want to recognize the solidarity of that day. So our case numbers and hospitalizations continue to remain steady and relatively low. We're just passing the window now. That's 2 weeks after we started with phase 2. We have 68 new cases to report. There are currently 123 people with COVID-19 in the hospital. Of these 123 people, 23 are in the intensive care unit and 12 are on a ventilator. Sadly, we have 9 new COVID-19 associated fatalities to report. One of these people was in their 60s, one was in their 70s, 3 of these people were in their 80s, and 4 of them were in their 90s. It's Father's Day this weekend, which is a day when we traditionally celebrate our dads, grandpas, uncles, other father figures, and family more generally. This is going to be a difficult Father's Day for many Rhode Islanders who have recently lost a loved one, and it's been a very difficult few weeks for Rhode Islanders who have lost loved ones. So please keep these Rhode Islanders in your thoughts and prayers today and this weekend. I also want to thank Governor, Commissioner Bonte Green, Secretary Pryor, and everyone else who have worked so hard on the thoughtful approach that has been shared today regarding schools and phase 3. As we continue to take steps in this direction, I want to reiterate the importance of the basic public health prevention principles that we have been discussing and are going to be core to our steps going forward. They're the same things we have been stressing and will continue to stress every day. Stay home if you're sick, even if you have what feels like very mild symptoms. Wear your cloth face covering. Keep it where you keep your keys, wallet, and phone so you remember to grab it whenever you leave home. Wash your hands often throughout the day using warm water and soap, or if they're not available, hand sanitizer or at least 60% alcohol. Do regular environmental cleanings on high-touch surfaces in the different locations that you visit, and use good cough etiquette. Cough or sneeze into your elbow. Something else we've been repeating for a long time is that you should keep your groups consistent and small. While the limits for many settings will loosen in phase 3 when we go there, people can and should exercise personal choice and responsibility. That's what we want to continue to encourage, that shared responsibility and that people can continue making good choices. If you are a person who is more vulnerable to COVID-19 because you have an underlying medical condition or because of your age, it will still be very important to limit how much face-to-face interacting you do with other people. People in these categories and all Rhode Islanders need to understand that your decisions have a role to play in shaping your risk profile. That's the direction that we want to be able to offer to you. What are the decisions that you can make that lower your risk of being exposed to COVID-19? The reality of this virus is that the more people you expose yourself to, the greater your risk of acquiring COVID-19. The more time you spend in places that feel a little more crowded, the greater your risk. So I'll finish with saying that we believe in you, in Rhode Islanders. We know that as we continue forward, as you go to a crowded place or see that people are not distancing 6 feet apart, you can make your own decisions about turning around and keeping yourself and your families safe. Let's continue to encourage that, celebrate where we have done well, and keep going forward to keep us safe. With that, we'll get started with questions.
Secretary Pryor, how do you, or I suppose, what's your recommendation to live music venues? Are they permitted to open up and have performers on stage without any kind of plexiglass barrier? How is that going to look?
A couple of different points. First of all, inside a venue, there's specific guidance for the performers and the audience. So the performers need to be 14 feet spaced from the audience. And there's specific guidance on that, as the governor indicated. Guidance that existed in phase 2 continues to exist in phase 3. There may be some tweaks here and there, but that would be an example. Also, musicians themselves have to be spaced, and there's a dialogue we can have with the industry about how that works. Then there's the question of the venue. So the venue, if it is indoors, for example, and it's greater than 250 seats, then there needs to be a plan, and that plan needs to be approved. More explanation regarding that process will also be available online.
Well, recommending that more than 250 people in an outdoor space is not a good idea, but also saying there's no cap. So was it premature for people to kind of cancel some of these larger summer events based on what you said earlier, or are you still sticking by that?
No, I don't think so. So first of all, at the time I said, so there are certain events like the Newport Folk Festival, the Newport Jazz Festival, absolutely not safe. I mean, those are thousands and thousands of people close together for hours at a time. That's not permissible. It's not permissible even in phase 3. And so we figured it was the right thing to do so they could, deal with their business. Well, what we're trying to say is we don't think you should have events greater than 250. Like, we are not encouraging that. We are discouraging that. It's our job to, if the doctor, if we could have a magic wand and say there could be no events, we might go that way. But we're recognizing that, human nature is such, and there might be unusual circumstances where there might be a couple of bigger events outdoors, 250 people. And so in that instance, call us and let's work it out so we can make sure that it is a big enough space and everybody's far enough apart and not close to enough, and people can be safe. But to be clear, when we say an indoor wedding, an indoor wedding is, there's a safe number and then a little bit more risk. You just need to know that. If you're going to go up to the 150 outdoors, you need to know that's more risk than 50.
Just be clear on the weddings. Should guests be wearing masks?
No. Right? Always encourage it, but you don't have to.
And just to clarify on the school mask wearing, again, for high school students within 6 feet under the full reopening plan, but elementary and middle school students would not be wearing masks?
We think it's impractical. So again, if you are a teacher who could convince a bunch of 6-year-olds to keep a mask on and stay 6 feet apart, God bless you, that is safer. That is the gold standard. But that's hard to do. So we're assuming that that's not going to happen. And so we're saying you have to, do these other things.
Are bars allowed to reopen?
So yeah, I'm gonna let Stefan handle that, but there's restaurants with the bars and nightclubs.
So bars are already permitted to be open in phase 2. There are specific bar operation guidelines that are available to help a bar operate in a way that is viewed as safe by the public health officials of our state. Essentially, it's restaurant rules. seated service, no standing service, no congregating. And we're in heavy dialogue with the industry about how to ensure that that's operationalized. So bars are open. As the governor referenced, nightclubs are not permitted to operate as nightclubs, and there'll be more guidance on that point.
When you said there are no caps at 250, does that mean that that requires some sort of special approval that if somebody wants to do an event that would be over 250, they should ask the state directly and get special permission for that particular event?
Yes, we're asking venues that outdoors would have larger events as possibilities to contact the state if they wish to host events that are larger, and there can be plans on the part of the venue that will be submitted to the state and approved. For indoor venues that know that they want to go in that direction, they should even more rapidly be in touch with us because they are required to submit plans. And we anticipate having to engage in dialogue with them and approve the plans. And that'll be a multiple department process, obviously always involved in the Department of Health.
Can I say one thing quickly? We'll answer whatever. This is important and it's different, and I want to make sure I hammer it home. What we're trying to do for phase 3 is make a distinction between social gatherings and what we're calling places of public interaction. So a social gathering would be a wedding, a birthday party, a family party, where you have mostly people who know each other, who are all going to be congregating with each other. And so that's to Brian's question, the wedding. So for example, so that is maximum 150 outdoors. We're calling a public place of interaction, you may be calling an event. So an event, a public place of interaction would be 4th of July activities hosted by a municipality, a festival, something else where people don't know each other, but they are all going to the same place. That we are saying, there's technically no cap, but we don't think you should go above 250. Outdoors, this is outdoors. There's technically no cap. We don't really want you going above 250, but if you really have to do it in phase 3 and you really have to go above 250, please call us so we know what's going on, so we can look at your plan and make sure you do it in a way that is safe. And principally by safe, we mean it's in a big enough place so people can be far enough apart.
When does phase 3 begin and what could change that?
Okay, when does it begin? We could change that. So my executive order for phase 2 is set to expire on June 29th. And I am optimistic that when that ends, I can do a new executive order to begin phase 3. What could change that? I mean, the data that we'll be getting in between now and the 29th theoretically could change that. So, we did have large protests a couple of weeks ago. Folks are going out and about a lot more. So if we start to see things that are very concerning in the next 10 days, then it might give me some pause. But that's, that executive order expires the 29th, and it would be, I'm hopeful that I could do a new executive order to then begin phase 3.
Governor,
Phase 3. Sorry,
Governor,
phase 3.
with the One Rhode Island Fund, what qualifies in your mind a Rhode Islander? We know they're not a citizen, but if someone arrived last Saturday and they set up shop here in Rhode Island, are they a Rhode Islander?
Yes. Yeah. I mean, you can apply, and we have these organizations that are, distributing the money. It's on the basis of need. So you have to demonstrate that you have need. You have to demonstrate that you've been here affected by COVID. So probably if you just arrived, no, that's probably not a good example. But these are people who've been living here, living through COVID, maybe lost their job through COVID, who are here, who are residents of our state, many of whom who work here and actually pay taxes here through their job. And they can kind of attest that they've struggled because of COVID in Rhode Island, and then they'd be eligible.
But we have high unemployment, people have lost their businesses, and essentially a fund of $3 million for people who are not U.S. citizens. Is that correct?
That is correct, but to be clear, other Rhode Islanders have been eligible for many other kinds of benefits. Every other federal benefit, the COVID relief fund, the extra $600, all that stuff. So yes, that is correct. It's all private, exactly. Zero taxpayer dollars. Yep.
Mayor Alorza had a ceremony. He's lifted Providence Plantation from the city of Providence. I asked you last week about that. You said definitely in favor of the ballot. Have you thought now in this week, maybe do executive order the same thing?
I have. In fact, I'll have some more news on that on Monday. I'm planning for Monday, but I was very, very pleased to see the Senate passed a bill to remove it. I'm hopeful the House does, and I hope it goes on the ballot this year. And if it does, I'll be stumping for it. But on Monday, I'm going to be making some other announcements on that.
Yeah, I have two questions actually for Dr. Alexander Scott. The first is on nursing homes, and I'm really glad that there's going to be an announcement next week in regards to the plans. I've heard from a lot of families who are upset that you can go to a casino, you can go to a strip club, but you can't see your loved one, and it's been like this for months. Can you give us a preview of what you're looking for and the plans when people can anticipate being actually able to see their loved ones in person?
Yeah, it's definitely an understood frustration and something that's been hard for us as well, because we recognize the importance of the emotional well-being, being able to see your family, as well as the physical well-being. The challenge that everyone has, though, which was why we have been at this point, is how critical it is to keep such a fragile population safe. What we've been doing in our interactions with nursing homes and assisted living is provided them guidance about 2 weeks ago on how to develop an individualized plan for visitation. We'll be working with them over the next several days to a couple of weeks to begin implementing, to begin thinking about how they want to approach it, provide more information about what steps they should do, and it will be a phased process. It also plans to be in alignment with guidance that CMS has provided, Centers for Medicaid and Medicare, that oversees and works with us in providing guidance to nursing homes. So we'll want to make sure that nursing homes and assisted living have the resources that they need to take a phased approach to make sure that families can visit, but do it safely, and ensure that we continue to keep our hands wrapped around this population, knowing the risk that will continue to be in place throughout the rest of this pandemic.
Is it reasonable to think that people will be able to actually have these visits, say, next month?
And next month being July, yes.
My second question for you, getting to the protests, I'm one of probably many people who got a COVID test because of being at the protest. Have you looked at the data from people who attended those protests? And if so, what is the rate of infection?
Overall, the rate of infection is very low at this point, less than 1% or so. We continue to encourage as many people who have attended protests, so I'm glad that you did as well, to go ahead and get tested. We continue to encourage, regardless of your test results, to monitor yourself for symptoms. That window for monitoring extends out to about 14 days after the time frame, and we'll continue to assess. I am encouraged. I know particularly the very large protests that we had at that finished at the State House with over 10,000 people, where we handed out over 5,000 masks. The overwhelming majority of people were masked. So I'm very encouraged that that core tool, masking that we talk about, distancing, that works.
Governor, we're seeing alarming rise in cases in states like Arizona, Texas, Florida, that in many cases were more aggressive aggressive about reopening. Without really pitting states against each other, I assume you're keeping an eye on that, and what lessons so far have you taken from those states' experiences at the moment?
I'm keeping a very close eye on that, as you might imagine, because it's scary. It's scary. You go through all this, and as I understand it, hospitals are full in Arizona, or parts of Arizona, and planning for their surge capacity. And first of all, it's just a reminder to all of us, don't get complacent. It can change like that. We learned that it's fresh in my memory. You go up the curve really fast. Once this thing starts compounding, you go up the curve really fast. So my mantra is stay ahead of it. If you let it get ahead of you, it's really hard. In any event, you point Arizona, suddenly hospitals are full. So here's my takeaways so far. If you look at these places, Texas, 45% of new cases in Texas are from the prison population. They have a different prison system, county jail system. So that tells you one thing. North Carolina, similar. It is specific to certain counties. If you look at the different states where they're having issues, it's mostly in particular counties or settings where they are having trouble in either communal living, prisons, nursing homes, meatpacking plants. There have been big issues in meatpacking plants, or some other population which is densely populated where, if you take your eye off the ball there, it spirals quickly. So now, in contrast, look at a place like Ohio. I look at Ohio's data and I take heart because they're quite similar to us. They've had a broad reopening like us. They're actually a little bit ahead of us, and they haven't seen any spikes. So I think you can't say a broad reopening will lead to a spike. But what you can say is, don't get lulled into complacency by looking at a statewide low test positive rate. Because even if you look at Arizona, Texas, Florida, their statewide test positive rate is below 10%, low. But they have counties or areas or instances of communal living where it was clicking up, and they let it get out of control. So that's why I'm obsessed with looking at our data in our nursing homes, in the ACI, in Central Falls, Providence, and Pawtucket. That's why I'm upset. That's why I'm begging people who work in close and contact businesses to go get tested. If we get into trouble again, you're not going to see it in a high test positive rate in the state. You might see, you'll see an outbreak in a particular community. So a long-winded way of saying, we know this thing thrives in density. We know there's certain communities that are at higher risk. And even though our test positive rate is extremely low statewide, we better keep our eye on those areas.
It's been 2 weeks since that large protest, and you haven't seen an apparent spike. Has that changed your thinking? Did it factor into some of this decision-making about what can be allowed outside? And what do you say to those people who've been saying all along, like, it's not a big deal outside and we should be allowed to have larger groups out there anyway?
So what do I say? So it makes I feel relieved, honestly. My real emotion is relief. I was worried. I still don't, I'm still waiting, holding my breath for another week or two, although all signs would suggest it's fine. But as the doctor said, mostly everyone was mask wearing, and we were passing out masks and hand sanitizer. And I think it's pretty clear that that was successful.
This question, couple questions for Secretary Pryor. Secretary Pryor, James Bissett from the Providence Business News. You laid out as part of the plan as to what some of the things are for indoor recreation. But what about like say trampoline parks and indoor roller skating rinks? Do those fall in the guidelines for be eligible for phase 3 to reopen?
The category of indoor entertainment and recreation is now allowed to open for individual activities where there could be contact between customers or where there otherwise could be challenges, we encourage the operator of the business to contact us, meaning through the Department of Business Regulation, and they'll consult with RIDO. So you mentioned, for example, a trampoline business. If it's a situation where it's just hard to know if people will be in contact has generally not been permitted either in the gym fitness context or in the recreation context. But we encourage them to call us if they think they hit one of those barriers or exceptions.
Okay, so what about like roller skating rinks?
Same, I wouldn't know enough about their operations, so they should call us.
Okay, so,
Yeah.
so they're technically part of phase 3?
They're permitted as indoor recreation. Indoor, I assume, could be outdoor. They're permitted, and if they have questions, they should contact us.
Okay. I talked to a couple other indoor recreation places, and they said that they've been having immense trouble getting